Hello, respected doctors. I hope you all are good. My name is Farhat Joya. So today we are having a webinar about the AMC Clinical, AMC MCQ, and how to become a registered doctor in Australia, how to prepare for the exam. So let's wait for a few minutes. And before that, if you have any question in advance, so please you can write down in the chat box, and I'm going to read the questions and going to answer it soon for you.
Hi, Dr. Farhad. Yes, we can start now. I guess a lot of students have joined us, so we can start now. Thank you.
Yes. Okay, very good. Thank you very much. So, respected doctors and dear students, so I'll give you a few minutes at the end. So if you have any question, either you can type it in the chat box or you can unmute yourself and just ask it from me, okay? Then I'm going to answer it. Okay. So, so what topic we are going to cover today? First of all, steps to become a registered doctor in Australia. As you know that for doctors, so it will take some exam preparation and a specific exam to be registered in a specific country. So today we are going to focus on Australia and how to become a registered doctor in Australia. Second topic is how to start your MC preparation. I'm going to talk about the MC Clinical and MCQ as well. So both of them that you will have a good information and understanding before starting your journey. A good guidance is very important because it once you choose the wrong country, so it will be very difficult to come back and choose the correct one because already you have spent a lot of money and to spend a lot of time as well. So that's why good guidance is very important. And if you have any question, any confusion, please feel free to ask me or write it down in the chat box because it's very important that you choose the correct exam and the correct country, which is suiting your lifestyle. Then we are going to talk about the career guidance of medical students, how they can become like a doctor, HMO, if they have some gaps, what they need to do. And also at the end, we are going to talk about the exam booking tips. Saying this, we move to our how to become a registered doctor in Australia. As you know that first you need to be graduated and have your MBBS degree, isn't it? But it's a little bit different from USMLE. In USMLE, I think the first exam you can give is in the third year, but in MC it's totally different. You need to be graduated. And once you graduated, so you have to, what you do, you have to do the assessment of your degree and university. See if it is recognized by MC or not, okay? Then after doing the assessment, then you have to pass the MC-MCQ. This is your first step. Then after passing the MC-MCQ, then you have to go through the MC Clinical. Then after this, English language test will be there. Okay, that could be, for example, you can choose that will be for like PT, IELTS, or OET. Then complete 1 year internship or house job is very important. And experience, how many years experience, it depends as well, but usually we do recommend like at least 3 years of experience postgraduate is mandatory to secure a job in Australia. But to secure a job as a doctor in Australia, it depends on the luck as well and how is your CV, and also like how hard you're working. You have to not you don't have to give up. You have to keep applying and keep applying. And you can apply as to become an HMO or to become a GP later on. So we are going to discuss everything in detail now. Okay. So we have certain pathways. So the shortcut for this is like people who are already living in Australia, they will have a better opportunity. What do I mean? If they pass MCQ, okay, then they have, let's say, like 3 years experience, and they can give the like PT, for example, or OIT exam, and they can start applying for jobs, okay? But they cannot escape MC clinical. They have to pass MC clinical to be fully registered, okay? But there's just a little bit advantage that you can also apply for job with the MCQ. But as doctors, for example, there are many doctors in Pakistan, India, Bangladesh, Sri Lanka. They can also choose this pathway that I've written here. Okay, it is not impossible, but the chances is a little bit lower than doctors who are already in Australia. It is not like you don't have any chance. You do have chance. Okay, but the chances will be a little bit lower than doctors who are in Australia. All right. So the best thing is that you go through this pathway and finish everything at once. Okay. I don't want you to have any gaps between MCQ and MC clinical. If you have gaps, so it means that you have already forgotten some of the knowledge. So you need more hard work. You need like a couple of months extra to uh, to remember the things and keep repeating and reviewing the information. So it will take a bit longer time. So it is very important that, in my point of view, that you pass MCQ, quickly move to the MC clinical and finish everything once for all. Okay. How I can become a GP or how I become an HMO? Okay, it depends the pathway that you're choosing actually. So once you have passed, for example, MCQ and clinical, okay, once you have passed these two exams, so you have two options. One is to become HMO, working in the hospital. One is that you want to become a GP directly. You don't want to work in the hospital. What will be the difference then? To become a GP, so you will need at least 4 years or more than 4 years experience. Okay, one thing. And the second thing is that you need to have at least like 4 years, like we call it the like postgraduate training. So they will give you 4 years of postgraduate training in Australia. And I've heard from some people that the government will cover some of the fees. Okay, you have to pay for this. Or in some cases, there will be no coverage. So you have to pay everything by yourselves. It is not a must, but it is increasing your chance to get the job, okay? Because they prefer, for example, if you have 2 years experience, if another doctor has 3 years experience, they apply for the same position. So obviously they will choose the doctor with 3 years experience. Okay. So this is the pathway for the GP. Like if you want to become directly a GP in Australia, that's everyone who wants to live in Australia. They want to become a GP. Why? Because the salary is very good. So that's why IMGs, their main focus is to become a GP in Australia. And how about the HMO? HMO will be, okay, so if you want to become an HMO and work, then later on become a GP. So what you need to do? First, you need to work 2 years in the hospital as an HMO in Australia, okay, once you secure the job. After that, so you will be registered with AFRA. So every year, so you can change your registration, like the amount of supervision that you need in the hospital. For example, when you start your work in a like a first year in a hospital as a HMO, so you'll be like 100% supervised. After 1 year experience, so you'll become like 80% supervised. You can apply for AFRA. Send the documentation, say that, okay, been working for 1 year now. I want to change my registration. So every year that you're working, so the amount of supervision on you become less. So it is something positive. Some doctors they love to do this, And some doctors, they don't want to do this because they don't want to accept the responsibility. Obviously, if you are 100% supervised, you have less responsibility. If you're 80% supervised, you will have a little bit more responsibility regarding to the patient. So some doctors, they don't like it. They just want to just work 2 years. They don't want to change their registration with Afra. After that, they will apply for GP-ship training, okay? So how many years they will have it? Approximately 18 months, okay? 18 months training. Then after that, they can start work as a GP. So to apply the job in Australia, so if for IMGs who are outside of Australia, obviously the chances will be very high if you start working in a rural area, not in a main cities, because that's difficult. They want the doctors who has already been working in Australia and having experience in Australia. Okay. Excuse me. Medical house officer. Okay. HMO stands for medical house officer. Okay. So let's go to the next slide. I hope this is clear. Let me see if there is any questions in the chat box. Okay. So there is not a specific guide that I can say like you do this 100% you are going to pass MC clinical in the first attempt. Nobody can tell you this, and it is impossible to tell you such information. Okay, it depends on you. How much do you study? How well do you prepare in the exam? How lucky you are? How lucky you are, like the questions that you know already. So you will get them in the exam. If you're unlucky, so you will get those questions that you have no idea about it in the exam. So it is very difficult to tell you specific thing that if you do this, you will pass it in the first attempt. Okay? It depends on your information, depends how you perform in the exam as well, because the exam is MC clinical is full of stress. You'll become anxious, you'll become tired, okay, you'll become disappointed if you think that you have answered one station wrong, so you'll be disappointed. So this disappointment can affect your whole exam. So it depends on your mental status. So there's a lot of things that it depends. So unfortunately, nobody can tell you the exact thing that you do this, you'll pass MC clinical in first attempt. Okay. Yeah, at the moment for MC clinical, because since we have only face to face, okay, then you have to unfortunately, you have to go to Australia. Hopefully, they start the online. Like, we have two options: clinical face to face and MC clinical online. So for doctors who cannot travel to Australia, so it's online will be a very good option. Yeah, it does not matter. Like they will not going to accept you if you're still a GP like 7 years outside of Australia. They're not going to directly tell you, yes, you can become like fully registered with AFRA and you become a GP. Okay. So you become a GP, but you need to follow this pathway that I have mentioned. You still need to go through this. Okay. Either 4 years, it depends because I don't know the exact how many years it needs to be like how many years experience you need to have to go through the 4 years pathway, or like they can reduce it to 2 years for you. So you have to send them an email and you can ask them about it. But this is the pathway that it is for general pathway for everyone. But about the exact like 6, 7 years, 5 years, 8 years experience, I cannot tell you anything. But I have told you the exact pathway which is like used for all doctors. Like we have HMO pathway and GP pathway. I hope it is clear. Any other questions, doctors? Yes, mock test is available for MC-MCQ and MC clinical, so no problem with that. There's not any exact percentage, doctor. Okay, that I can tell you that this is like 20% or 30%. Okay, because it depends on many things. First of all, let me write you what it depends on. First of all, the way your CV is looking, okay? The way your CV is looking, one thing. The other thing is that years of experience, like which passport you are holding, okay? Like what is your citizenship, and also like how lucky you are, okay? Sometimes like luck play a major role in getting job. You know this already. Like if you're lucky, you will get it in the first attempt. Otherwise, you need to. It may take a year, 2 year. It depends, or it may take only a few months. So for like the HMO campaign, twice a year. Okay, so you can apply in this period. Otherwise, you cannot apply. And if you miss the chance, you have to wait for this HMO campaign to reopen. Yeah, if you have like let's say like at least or like 2 years experience in UK, so your chances will be very high to get a job in Australia. Okay, it will be very high because having MRCP and 2 years of experience in UK will be a huge help. You can to improve your CV, you can go to the AFRA website, okay, or a CGP website. So you can download a sample of the CV that they have written. So you can use the same format for your CV. So it depends for which part of Australia. So because we have different states in Australia, so not all of them open at the same time. So they will open at different times. So usually you can keep your eye open around May, okay? And May until July and August. So different states will open their timing for the HMO campaign in different times. So you can join the Pakistani doctors Facebook group. So the name of the group is Pakistani doctors, but it's not only for Pakistani doctors. All the international doctors are there. There are many thousands doctors. I think more than 2,000 doctors are in that group. So if you have any question, if you have any confusion that I cannot answer it because it's very difficult, but you can share your question in the Pakistani doctors Facebook group. And there are many doctors who already have secured the job position in Australia. They can help you a lot with that. The med exam expert can help you with your CV cover letter templates. Okay, that's another good news. It's a huge help, to be honest, because there are many other doctors or like people who can help you in Australia to correct of money. Okay, yeah, because I got a message last year from one of them, and they were like, she was so okay. So let's go to the next slide. How to prepare for AMC. When we come to the medical school, it's important you understand and learn. We need your basics to be perfect. Okay. Then we have the MC handbook that you can go through it. You can download the PDF form, or I think the med expert will have it and can share QBanks. You can subscribe to the QBanks and solve as many questions as you can. Okay. And for the QBanks, I think it will be a little bit expensive. I do understand the financial situation and difficulties for doctors who are living in Australia, in Asia. like because I'm also living in Asia, like it is very difficult. I do understand that. But for that, like you can like if you subscribe by yourself, so like if one person subscribe, it is very difficult and it will be a little bit expensive. But what you can do, you can join the med exam expert, and it will be much cheaper. Also, a lot of if you want to save some money, like option. Then you need to have live classes. Why live classes are very, very important for MCQ? Because it will give you a good timetable. Okay, according to that timetable, they are force you and pushing you to move according to timetable. That's very good. They'll keep you motivated. There will be classes, there will be other doctors, there will be study groups. So all of them will push you and keep you motivated by any time. If you don't want to study, if you want to give up, so this timetable and the MCMCQA groups will keep you motivated and push you towards your goal. Okay, discipline. If you join the live classes, so one other thing that you will get is discipline because the lecturer will teach you the information. Okay, will help you, will guide you. Then for like this, you will have a discipline because you know like which days you're having class, you need to prepare for the class, and after the class what you need to do. Like this you will have a good timetable for yourself and have a good discipline. The other thing is saving a lot of time. Okay, so live classes advantages, saving a lot of time. How? Okay, for example, if you don't know a topic, for example, then you have to keep searching in your books, you have to keep searching in the internet. It may take you like 30 minutes or more. It's not only one topic, so you will come across to multiple topics that you don't have exact idea about it. But once you join the live class, you will ask your question from the mentor, okay? And he will answer you within minutes, okay? And for example, if you have the same question or confusion, maybe they are going to cover the same topic in lecture that you don't need to waste your time by searching in the internet and go through your old notes and go through your books. So it is like a lot of, you can save a lot of time. All right. When we come to the or those questions that has been appeared in the exam previously, not all recalls we do is that in the live class we will choose the best recalls, and those recalls they're more frequently. Okay, there's another advantages of the live classes. Then it is not a must to have a study group, but it is important. It depends. Like if you're good at studying by yourself, you have the habit and you're good at it. Okay, so you can do that. But those doctors who like need some other doctors to help them in the group so they can have a study group. So make sure whenever you have your study group, so maximum 3 doctors can be in that study group. Not all doctors will get enough time to discuss. And the other benefit of a study group is if you don't know any topic, you can write it in the study group. And the other doctors, if they know, they can answer you at this they can answer you and you save a lot of time by not searching by yourself. And mock test. Mock test. Mock test is also quite important. So it is recommended that you can have at least 2 mock tests.
Dr. Farhat is facing internet issue. He is joining us again. So basically, he was explaining about the mock exams. Mock exams are very, very important. Why? Because it will give you a real exam like experience in which you can practice the questions and get your desired score, and you can check and read the explanations. What are the problems that you are facing in the mock exam, in the questions, so that it will really help you to understand in which part of your preparation you are currently in, and then you can work on your weak areas. So that's why mock exams are very, very important. So I guess let's wait for like few minutes so that Dr. Farhat can join again and he can continue. Thank you. Meanwhile, Dr. Farhat joins the session. You can write in the chat box if you need any guidance regarding AMC MCQ preparation, or you want any guidance regarding AMC clinicals preparation. I can guide you better in that regard, so that Dr. Farhat can join in and he can also share his expert, guidance. So if you have any questions, you can write in the chat box. Yes, Dr. Sid, you can use JM as your like a guidebook, because there is not a specific book that you can use to prepare for the AMC MCQ exam. So you can use the reference books, and in the reference books you can use JM, you can use Kaplan series, you can use CK. All these books can be used to prepare the theory. But you have to keep this in mind. For preparation of the theory, you have to keep in mind the recent guidelines, the Australian guidelines, and you have to prepare the important topics as well. Like, let's suppose if you are preparation doing your preparation from any reference book, then don't stick to that book wholly. Okay, you have to consider the guidelines, you have to consider the important topics, and then you can prepare any topic from any reference book. So Dr. Farhat has joined in back. So Dr. Farhat, you can continue. I was just explaining about the preparation guidance.
Yes, thank you very much. And I'm sorry, guys, because of the network issues. So unfortunately, there are some network issues today. But okay, let's continue. So mock test is very important because you will evaluate yourself before the exam, so you can have your mock test as well. So let's move to the MC clinical. In MC clinical, again, like you need a topic like live classes are very important because that format of the exam is totally different. Okay, then you can have to live role play with your mentor, with your study groups. So live role play is very important. And study groups, you can have like study group. It is recommended that maximum 3 doctors can join the study group. Like this, you will have enough time to prepare yourself and you discuss, and you are doing the live role play. So MC clinical is totally different. So you need a lot of practice until you get used to it and you know the tricks and you understand the question and you know how to perform it. So during the exam, it is very difficult because you'll be under stress and the time is very limited. So the maximum time for each station that you have is 8 minutes. Okay. So let me see. I think one of the doctors has asked one question. Yes, you can use the Red Book. You can use the RACGP, RCH guideline. So you can search the information into the guideline because the books when they have been printed, let's say they have been printed 5 years ago, and since then there might be some changes into the guidelines. Okay, so you need to be updated regarding the guidelines. So you keep searching in the Australian related website for the new guidelines, for the new changes. Okay. So regarding the recalls, yes, recalls are very important here as well. So you'll get recalls. You can join the Telegram group or some WhatsApp group or Facebook group. You will get the recalls for MC Clinical, and you can solve the recall by yourself, make a file and make everything clear and ready. And have a structure for MC Clinical. What do I mean by structure? To pass the MC Clinical, again, it is very difficult to tell you if you can pass at the first attempt or not. Okay, it's very difficult. So nobody can tell you this. So it depends on many factors, as we have already discussed. But one thing that can help you to study for MC Clinical is to build your own structure, or we can help you to build a structure. What do I mean by structure? For example, this is, let's say, a A4 paper, and you need to understand more, like around 1,000 questions, or you need to study around 1,000 questions and practice them in order to get a good score in the MC Clinical. Okay. So do you think that to make is it possible to memorize all the information from the 1,000 questions? I don't think so. Nobody can do that. So that's why we have built a structure. For example, if you have abdominal pain, both acute and chronic, okay? So for this, for the history and differentials, so we have built one structure. Let's see, one structure history that you can apply to all, for example, let's say 50 cases of the GIT, abdominal pain, both acute or chronic. So you don't need to make 50 different histories, okay? We will make a one good structured history that you can use it for 50 cases. Same as, for example, for the headache, okay? For the urinary problem, for example. So there are many cases. So they are like, we need to build a structure, okay, for them. So you can use one structure for many different cases regarding the same topic. For example, for headache, I think as much as I know that we have around like 20, 25 cases maximum for the headache only. So you cannot build like a 25 different history. So we will make one structured history for you, and you can use for all these 20 to 25 cases. And the other thing regarding MC Clinical is that it is exam of differentials. It is exam of differentials. So you need to have at least 6 to 7 good differentials for MC Clinical. Okay? You cannot, for example, give the differentials. Let's say the patient is present with chest pain. So at the end of your time, so you want to tell the differentials to your examiner. So you cannot tell the examiner 6 to 7 pulmonary system differentials only. They're not going to pass you. You need to involve other systems as well. Let's see, you can say like 3 pulmonary, for example, is just example. Differentials, 2 like a cardiovascular, or like 2 like GIT cases, okay, and 2 for psychiatric cases, for example. So like this, you can mix your differentials, and you can have many differentials, good differentials from different systems. You cannot tell only like 6 and 7 differentials regarding to pulmonary system, for example, pulmonary embolism, pneumothorax, hemothorax, pneumonia, atypical pneumonia, and for example, pulmonary embolism, pulmonary lung cancer, pulmonary abscess. We have lobar pneumonia. So like, for example, COPD, asthma, you cannot, this is not good differentials, doctors, okay? So that's why you have to be aware of your differentials. Okay, let me see, I think there are a few questions in the chat box. Yeah, yes, doctor. So it is enough. Okay, I'm being honest with you. It is enough. But not only mid-exam expert courses can pass you or guarantee you to pass the exam. We need your hard work as well. It's not like, okay, I've joined the mid-exam expert and I'm going to study like 2 hours a day, plus like joining the live classes, and I should pass the exam the first attempt. No, it is not going to work like that, okay? Any classes or any courses or coaching courses that you are joining, you need to work hard. You need to sacrifice. You need to give everything you can for this exam because this is your dream. And it's not a small dream. We know this. So once you become a GP, once you become a doctor in Australia, you'll be secured, at least financially. Your family will be secured, at least financially. That's something huge. It's not a small dream, it's a big dream. So you need to have a lot of sacrifices. You need to study a lot beside the live classes. It's not only with med exam expert, whatever coaching course that you are joining, they're not going to guarantee you that you pass. If they guarantee you that you pass, so believe me, they're not being honest with you because you need to work hard yourself as well. We are going to help you to give you a timetable, to save your time, okay? To help you to solve questions. You don't need to look for the questions. If you, for example, don't have time, you can send it in the group. So the doctors will help you to answer the question. So we will give you a good timetable, discipline. We will keep you motivated. We will give you mock exam. We will give you QBank. So if you don't do all this, so unfortunately, nobody can guarantee you that if you can pass in the first attempt or not. So it will be up to you, doctors, okay? So obviously, so every coaching teams, they are going to do their best, but you need to do your best as well. Okay. How much time do I need to prepare for MC exam? So we have MC MCQ and MC clinical. For the MC MCQ, so I'll give you the two different scenarios. Let's see, MC MCQ. If you are person, you have like 5-6 hours, you can do like 5 to 6 hours study daily. Okay. Then the amount of time that you need is like 5 to 6 months. I'm telling you 5 to 6 months because I want you to pass in your first attempt. Okay, so you need to study smart, and you have to study hard, like at least 5 to 6 hours daily, then 5 to 6 months, and like the chances will be to pass is 90%. Okay. So we need your dedication, we need your discipline, we need your hard work. Okay. All right. Then we have another doctor. Says, doctor, for example, I'm a housewife and I have two children that I need to take care of. Or there's another doctor says, like, doctor, I'm going to hospital and I'm working. And how much time I can give is like maximum 3 hours daily. Okay. So for this doctor, so I believe like there will be like 8 months. Time will be a very good time to prepare and try to pass the exam in the first attempt. So this is like two different scenarios that I've given you about the time. How much time does it need for MCQ to prepare? Could be 5 month doctor, 4 to 6 hours study every day. So 5 months. The reason I'm telling you 5 months, because you don't have to, we don't want you to push you. For example, you're not going to rush to book your exam and give the exam as soon as possible, unless you feel that you are 100% prepared. So if you study, let's say like 6 hours, and you like 6 hours daily, and you have been a good student, school student, okay? and you have a very good like basic knowledge already. Like your like basic knowledge is very good, okay? And you are going to study 6 hours. So usually 4 months will be enough. But the reason I'm telling you 5 to 6 months because this is a very expensive exam. I want you to pass in the first attempt. Okay, I don't want you to rush because I don't want you to pay a lot of money for this again. And paying is another problem, and feeling depressed after failing the exam is another issue. Okay, so I don't want you to suffer financially and mentally. That's why I will recommend 5 to 6 months. Please do not rush. Okay, 1 month, 1.5 months, or 2 months earlier or later does not change anything for you. So the only thing is that we want you to be 100% prepared and pass it in the first attempt. Yes. So it is not like if you, for example, just in case, so we will look at the both scenario, both positive and negative. If you pass in the first attempt, all is good. You're happy, your parents are happy, everyone is happy. You'll feel good. If you fail, so what does happen? You will suffer financially and mentally. Okay, that's something true. So we cannot avoid it. That's why I told you that, like, okay, if you have been a very good student, so 4 months will be enough for you. But I don't want you to push you. I don't want you to put you under a lot of pressure. Okay, I don't want you to suffer financially and mentally later on. So that's why I've said like 5 to 6 months. Please do not stress yourself and do not rush. Okay, 1 or 2 months earlier or later does not make any changes for you. Yes, mock tests will be available, doctor. So we have a lot of mock tests actually, like with med exam experts. So the thing is that you will have many mock tests. Okay, as many as you want. We should, when should we book our exam? Ideally, 2 months before the exam date. Yeah. So when we are talking about MCQ, booking the exam is a little bit easier. So one, like if you are confident, for example, if you're confident that you can book your exam in March, okay? Mention how much you'll be prepared, and according to that, you book your exam. So, okay. So according to that, so the reason I'm saying this, like if you study for 3 months, you will know where you're standing and you will understand yourself. You can evaluate yourself, like how many months do you need to be 100% prepared. So once you book your exam date, for example, it is March now, it is March, okay, 1st of March, and you have booked your exam already. So it means that you'll have around 3 months. So what will happen? So because you have paid a lot of money, Respected doctors, I'm extremely sorry because of the network issue, because there's some electricity issue over here at the moment. So they're fixing something, so it just happened suddenly. Okay. So was there any questions that you wanted me to answer and I forgot to do that? How to approach difficult MCQ? Finally, okay. Difficult MCQ. So first of all, if you don't have any idea, so quickly you go and search your the topic in the website, Australian website. Okay. If it is like pediatrics, so we have RCA uh, like a Royal Child Hospital of Australia. You can search there, or you have like the like Red Book guideline will be there, or even like if you think that you can find it in RCH guideline, you can do that. RACGP guideline, you can do that. So rather than just thinking by yourself or going through your notes or your books, it will be easier to search in the internet. Just in case you have searched in all these websites for 10-15 minutes. If you didn't get any answer that can satisfy you, so don't waste your time more than 15 minutes, okay? Just search the question in the group. We will have many groups uh, for the doctors who has joined med exam expert. So there are many doctors in that group, so they can answer your question. So if it is a difficult MCQ, try to solve it by yourself. Okay, 15 minutes max. You cannot spend more than 15 minutes. Doctor, so I don't know about the MRCP pathway. Thank you. Because we are discussing MC only. Okay. Which Q bank is better, Armidex or Mplex? So it's very difficult. So all of them has its advantages and disadvantages. So I think later on at the end of our webinar, so you can ask this question from Dr. Asma, who can help you because she has been uh, helping other doctors to pass their exam, and she has more experience than me at this topic regarding this. What would be good to score for mid exam expert mock test? Okay, doctor. So it depends. Okay, it depends. It's not like this. Let me tell you. If you get like, let's say like 80% in the mock test, okay, it's not going to guarantee you passing the exam. Okay, it's not going to guarantee that you can pass the exam. So, okay, you will have a good chance to pass the exam in the first attempt. You will have a good chance to pass your exam in the first attempt. But maybe during the exam, you become anxious. Okay, or you become like you cannot stay calm. You cannot stay calm, or your mind freezes. It happens because of the stress. So even if you get like 80% and you like perform terribly in the exam, so it's not going to help you. The thing is, but we are going to do it generally, isn't it? So I've given you these examples that you should be aware of the negative side of it as well. But ideally, so we want you to get like 15% extra. Like if you get, let's say, 75% in your med exam expert mock test, okay, we will expect you to pass, okay, in the first attempt. We will expect you to pass in the first attempt. So if you get like 75%, so it means that there is like 15% difference should be there, okay? Just in case. So in case you become anxious during the exam. So this is for generally like most of the doctors, let's say like 90% of the doctors, if they get like 75% or above, so we do expect them to pass their exam in the first attempt. Okay. Difficult question in the exam. Okay. So since we have started with med exam experts, so what we have done, okay? So the thing that you're going to do for Australian exam is, let me tell you something. First, let's see, this is your question. Question number one. It is given like a small paragraph regarding this. And the end part of the paragraph will ask you what they want from you. You have to be able to understand what the question is asking you. Don't just go through it and say, oh, this is the recall that I've done lastly, like let's say like 2 weeks ago, and it's exactly the same question. And the answer was A, let's see, A, B, C, D. It was A. So I'm going to choose A without reading it. No, please read the question carefully. Understand what the end part of the question is asking you something. Understand it. Okay. Think about it for 10 seconds. Like what is it's asking you? Are you understanding the task correctly or not? Okay. Then you move down and you do the exclusion method. That's the best one. For example, based on this, I think, for example, B is not possible. C, it does not make sense because it's like this, it's like that, okay? So you're left with A and D. You're not sure which one of them is this. So you will put 30 seconds and see if A is the best option or D is the best option. So you can choose one of them, okay? Or you can say like B is no, C, no, I don't think so. D, I don't think so. Okay, I'm left with A, so this must be the correct answer. So that's how you do, and you save a lot of time, okay? When you read the question, so there will be certain key points. The stars are, for example, the key points. So you make sure that you understand the key points and you remember it, and you can connect all these key points and analyze these key points in your mind. And at the end, read and understand what the question is asking you. Like this, you can understand the question and you can pass it easily, okay? So, but still, um, as you know that nothing is easy, especially like to become a doctor. Even like being like a medical student is not easy. So yes. So yes. So if you, let's say, if you start, let's say question number one, question number two, question number three, question number four. If you have all of them correct, okay? Let's see. So question number five would be difficult. Okay. Question number six, if you have it correct as well, question number six will be more difficult. For example, if you have this wrong, so question number seven would be, let's say, like medium difficult. If you have this wrong as well, question number eight will be like easy one. Okay, so they're building like this. So they have built a program that can build a question like this regarding their difficulty level. So it can be varied during their exam, during your performance, but you will not know because unless you get the result, you will understand. But you can understand that, okay, I've answered like, I'm sure that question 1, 2, 3, 4 is correct. Okay, so expect a difficult one after this. This is the pattern that AMC is following. Okay, so let's go to the MC clinical. We are done with MC MCQ, MC clinical. So for MC clinical, it depends again, like how much knowledge do you have, how much time do you spend. So approximately, if your preparation should be enough. If you have like 3 to 4 hours, let's say daily, you can spend here. So approximately, like we will take you like 8 months preparation will be there. Why? We don't want you to rush because we don't want you to suffer from financially and mentally. Okay, how can I book for the MC MCQ? For the MC MCQ, it is easy to book. You can log in, you can make your own portfolio. Okay, and obviously you have to pay for this. Everything, nothing is for free in Australia, so you have to pay for this. And you can search in the website, so the amount has been increased recently, I think. Then after that, you have done the assessment of your degree. Okay, again, you have to pay for this as well, that they should assess and do recognition of your degree. Then after that, for MCMCQ, you can go and click in the MCMCQ and book the exam date and location, like exam center, okay? All right. So that's how you do. But it is very easy to book for MCMCQ. Okay, you don't have to stress yourself. You can book easily. Mostly you will not get any anatomy questions, okay? You'll not get any biochemistry questions because the subject has been cleared and it is mentioned already. So they are bringing the question from those subjects only. Doctor, I think Lina Muhammad, we have discussed this in very detail. I think you are not there. Uh, so for your question, I've answered this already. But if you were there or if you are not there, then I can take some time and explain that again. Okay. Okay. MC Clinical. To book your exam date for MC Clinical is a nightmare. Okay, it's not easy because many doctors wants to book. First of all, for example, they will open it in February, for example, 2025, or next 3 months. Let's say for like April, May, and June, for example. Okay, so there will be a huge traffic because all doctors, for example, they want to book their exam in these dates. So they will start logging in. They want to book their date. So you have to be fast as a flash. You have to be very fast. Keep your credit card ready. Be good at the typing and make sure that you have decided previously like which date you want to give your exam. It's not like you log in and you think, okay, should I give in April, May, or June? I'm not sure. By the time that you decide after 10 seconds, so the website closes, okay? There is some bad experience as well that the website crashed many times, okay? During the booking time, and it was like out of service for 4 hours, 5 hours. So it is not easy, okay? So that's why you have to be prepared for MC Clinical if you want to book it. So you have to be very fast and you have to decide about the date previously. You don't have the time to think and you have to book within 10 seconds, okay? Otherwise, you'll miss the chance and you have to wait for July, for example. We have talked about until June here, July, August, for example. I have missed twice myself. So that's why I'm telling you this. I have a bad experience from this, and many of my friends and colleagues they do have also like horrible experience regarding this. And make sure that you understand like which bank card that they are accepting. Okay, so you will have that. That's the exact bank card that they are accepting nearby, and be fast in learning. Um, Dr. Lina Mohammed, so it was just an example. And that, for example, in February 2015 is not exactly the same thing that can search in the group and in the website, MC website. Okay. And you'll see like for open at least like 3 months once at a time. So once they open, for example, in February, so they'll open for the next 3 months. Okay. All right. Can I still do MC with 1 year of clinical experience, that is internship and MBBS? Yes, you can pass, you can give your MC exam even if you have just graduated. You don't need any experience to give the exam. Please accept my apology, doctors. If you had any question, please, if I did not see the question due to disconnection, so you can type your question again. And I would love to reply you. Let's go to our, okay. Let's see, I have one question here. Okay. So let's see. So let's go to some other information. The last part is like, okay, doctor, I have like 2 years gap or like more than 2 years gap. What should I do? Is there any chances for me if you are living already in Australia? So the good chances that you can get like a volunteer jobs as an HMO for a couple of months, 3 months, 4 months, or 5 months. Okay. So they will give you certificate for that, and you'll have after this you will have a good chance to work as a HMO in Australia. Okay. For this, you need to finish your house job. Okay. This is the example of like my prep and Monash that you can search it there. And if you have some gap, but if you are already like in Australia, the chances will be very high that they accept you and cover that you can cover your gap. Okay, you will have some experience by working like in Australia. But if you're outside of Australia, if you still want to do that, so you can do that, no problem. You can apply and see what they are replying to you. But ideally, the chance will be a little bit lower that they can accept you like this. But we never give up.
So, meanwhile, Dr. Farhad joins the session. I can share some amazing tips and tricks and about the course details as well, like how you can start your AMC preparation. So these are the some of the tricks that you can use to ace your AMC exam. First of all is that you have to make study partners, because I understand this thing. Studying alone is not very easy. Like practicing questions alone when you don't have any study partner with you, then it's very, very difficult. So if you have a study partner with you that can help you in your preparation, that would be best. And how you can find a study partner. So once you join any course, you will be added into a study group, you will be added into a WhatsApp group or Telegram group, whatever course you are joining in, and then you can make study partners from there. The second tip I would like to give you is that always study precisely, not the whole box. Like I told you before, that you have to focus on the important topics only, not the whole box. Okay. Number three is less reading and more solving of the MCQs. And how you can do that? You can use Q banks, you can use mock exams that will really help you to practice the questions and see the real exam scenarios that you will get in your AMC exam day. So, number four that I would advise you is to take more mock exams. Why? Because mock exams are going to help you and like help you prepare for the real exam. So, mock exam practice is very, very important. And number five is guidelines. Guidelines are very, very important. So now let me introduce you to our AMC mentors. So once you join our courses, we have the best faculty that is going to teach you in our AMC courses. Whether you are joining AMC MCQ course or whether you are joining AMC clinical courses, these are the faculty that are going to teach you and guide you. We have Dr. Farhad, Dr. Nabira, Dr. Amtal, Dr. Samaya, Dr. Devich, and Dr. Chinmay Trivedi, who are going to guide you throughout your journey. So we are offering bundle offers for the AMC MCQ preparation. We are offering regular courses, we are offering recall crash courses, and we are offering exam week sessions. And exam week sessions are basically conducted during the AMC exam days to share you the new question that AMC is giving in the exam papers. So you can join any bundle offer, like you can join regular or crash course or exam week session, and you can get up to 60% off on the bundle offers. Now let's look into the courses that we are offering. So we are offering regular course and the recall crash course, and it is best for those people who want to start the preparation from scratch. Let's suppose if your basic knowledge is not good, so what you can do is you can join us for the regular course in which we are going to cover theory based sessions. There will be 42 live sessions along with their recordings, and their PDFs will be provided so that in case you miss any live session, you can watch the recording later as well. And then we're going to provide you the question bank with 5,000 plus questions that you can practice on the website along with correct answers and explanations so that you know what kind of problems you're facing in solving the scenarios, and you can re-attempt the test as much as times you can. And then we're going to provide you the recall quizzes that will really help you to understand how AMC gives questions and how you can improve yourself. Then we're going to provide you the notes and flashcards that will really help you to just focus on the important points, not reading the whole box. You can just go through the notes and your topic will be well prepared. Then we are going to provide you solve recall files so that you know in every exam what kind of questions are AMC giving. And then we're going to provide you the psychiatry workshop that will really boost up your skills of psychiatry. The duration of the course is for 4 months and is starting from 20th of February. And for the recall crash course, it is for those people who just want to practice the recalls and their basic knowledge is good. So we are providing 15 live session in the recall crash course along with recording and PDF and all the stuff that I have mentioned before, like QBank, quizzes, notes, everything will be provided to you. And this course is for 3 months and it is starting from 10th of March. So you can book your slots for regular course or recall crash course depending on your preparation so that you can choose the best one that is best for you. So this is the sample of a schedule that will be, let's suppose if you join the regular course or the recall crash course or any course with Medicine Expert, we are going to provide you a proper study schedule, like how you have to prepare your modules. So let's suppose if you're starting with the medicine module, then we're going to let you know on what days you will be having the live session, on what days you have to attend the topic test, on what days you have to practice the recalls, and on what days you will be having a mini mock or group discussion, so that it will really help you and motivate you to study properly for the AMC exam. So for those people whose exam is very, very near, let's suppose if you are going to attempt for February exam or March exams, so we have a special offer for those students. What they can do is they can join us the recall sessions that we have already conducted along with February exam papers with Dr. Nilofer Abru all in one. So if you want further details regarding this package, you can just drop in a message on the number available and we can share all the details with you. So these are some of the amazing reviews from our AMC students who have trusted us and joined our courses, and they have expressed their emotions, how the course was, how the material was, how the content was, and how the website was, and how it was helping them in preparing for the AMC MCQ exam. These are some of the feedbacks from the students who have joined us and then they have passed the exam. They have shared their reviews with us. So this was all from my side about the courses. If you need any details, if you want anything regarding the courses or how you can do your preparation, we are more than welcome to guide you. We have shared our numbers. I've shared my number as well. So you can just contact us and we can to provide you the free guidance. So Dr. Farhat, over to you. Do you want to add something over here?
Okay, so I just want to know if the doctors have any other questions that want me to answer. So I would love to help them. And if you want any other questions, like later on it comes into your mind, so my WhatsApp is in the group. So you can text me privately, okay? Or you can tag me in the group, then I would love to reply you. So let me look at the chat box. If you have any question, you can unmute yourself or you can write it down in the chat box. Then,
Hello.
okay, Dr. Asma, I think this question is for you.
Yes,
From
tell me.
Dr. JB, what online courses specifically, please? Okay. So online courses, we do have two types of courses. Like actually, if you want to prepare for MCQ, so we have, as Dr. Asma mentioned already, that if you have your basic, good basic knowledge and you have already started preparing yourself, so crash courses will be for you, like recall crash courses, okay? There will be mock tests and Q banks and solve recalls will be there and the PDF and the videos will be there as well. But if you think that, okay, you're not well enough prepared and you need some more time and you need guidance, so we will recommend you to join our daily courses. Like it's like 4 months course. So it'll be like 42 plus classes, live sessions, mock test, and more than 5,000 Q banks, PDF, and the videos will be shared with you. So you can evaluate yourself, Dr. JB. So like which one is best for you? Okay, is there any other questions, doctors? How is the overall measure in Australia for new AMGs doctors? Okay, some hospitals, so let me tell you, like some hospitals are very friendly, okay, with IMGs. But some hospitals, I've got some feedback from my colleagues or my friends there in Australia who was already working there and living there. And some of them are like a little bit tough. Like first year will be a little bit tough, okay? It depends which hospital, which region of Australia you are going to secure a job and a position. But first year, just put in your mind that it will be a little bit tough because you don't know anything about the system and you're learning. They'll expect you to make a lot of mistakes and you'll be disappointed after working for a few months, let's say like 6 months. So you would understand how everything is working in this specific hospital, okay? So that will be easy. But first 6 months, so remember that it's difficult, but okay. For a small family, it's very good actually. Australia is the dreamland for many doctors, not only for doctors who has been like from Africa continent or Asia continent, Europeans and from the UK. Most of them they move to Australia and work there as a doctor. Why? Because the salary is higher and the weather preference. The weather because some people they like to have live in a warmer climate, so they do prefer Australia for that. No, unfortunately, house job will not count as experience. Okay, but it is a very good advantage. You will have a very good advantage if you have done your house job compared with a doctor who has not done their house job. Okay, any other questions? So I hope I have answered and Dr. C's question. And again, I'm going to apologize regarding the